Hello and welcome back to A New You, Maximizing Life with a Disability. I'm Scott Chesney. Today my guest is Lori Vickers. She's the manager of therapy services here at Gaylord. How are you?
I'm doing well, thank you.
Nice to meet you.
Nice meeting you.
So 27 years you have been in this industry. What inspired you to get into this industry?
Well, I always wanted to do something in the medical field, and physical therapy just seemed to fit the bill of what type of thing I wanted to do. Years ago, when I was a kid, I wanted to be a doctor, and then kind of switched things along the way, and physical therapy just seemed to fit a little bit more about what I wanted to do. And rehab definitely fit what I wanted to do.
What are some of the major changes that you have seen with regards to services that are given to patients?
Okay. I think one of the biggest things in healthcare is time frames of things. Length of stay, of course, in a hospital has changed. It's decreased a lot. Some of that's good and some of that's bad. Years ago, people, if you had a spinal cord injury, you could be here for 9 months a year. Now you're here for a couple of months. So huge changes. And one of that, part of that is people aren't allowed to stay for as long and into the process as they used to be able to. But also there's different efficiencies. Things have gotten more efficient and things have gotten better. So length of stay is one of the hugest changes that we've seen. The way insurance plays a role into things has changed immensely too. I remember when I first started working here, you rarely talked about insurance. It just wasn't something that you spoke about that much. It didn't play that much of a role in what we were doing and how long somebody stayed and things like that. And now it's an integral part of the conversation as far as insurance goes. But the basic of working with patients to get them better, and the excitement of seeing them come in at one level and move through and leave at a much better level, that never changes. And that's why we're all here, and that's the exciting part, and that relationship that you have with the patients that you serve.
One of those things that I have to feel on some level is a challenge, though, is the mental preparedness and the psychological. Do we see, have any studies or anything been done to say, hey, you know what, patients are ready to go home and we've kept them longer? I understand because of insurance purposes, but if this was an ideal world, would you like to see like a happy medium? Every individual is different.
Every individual is different, and I think there is kind of a happy medium somewhere. Sometimes it is fast and sometimes people aren't quite emotionally ready. At the same time, years ago when somebody stayed a year, I think in some ways that was hard too, because they've been in this encapsulated environment for a whole year, and it's scary to go back out into the real world. So I think sometimes keeping somebody in an institution for too long can make that even more of a nerve-wracking process.
Absolutely. Well, Lori Vickers, it was a pleasure meeting you,
Thank you.
All the best, and thank you for serving my extended brothers and sisters.
Thank you.